So we check for past history, present history, could be OPQRST, sample, those type of questions. We're looking for swelling. Or can you please put your phone down? Swelling, discoloration, and deformity. All right, and then the carrying angle. So please hang your arm. So in anatomical position, wrist palm up. Yep. See, that's the carrying angle, and we're checking if it's bowing would be when it's like that, looking for that. Then we would do the bony palpations. So bicipital humerus, bicipital groove there on the humerus. Then if we go further down, this is the humerus shaft. Then we have the olecranon process right here, and behind that, which the olecranon process is on, is the olecranon fossa of the humerus. And the olecranon process is of the ulna. Okay. Then we would look for the ulnar shaft. So go ahead and do that. So this is the ulna and the ulnar shaft. Then this is the ulnar head. Distal, proximal, radial shaft, radial head, distal, proximal. Okay, now that's all the bony palpation. So soft tissue, we have the biceps brachii, which is anterior on the arm, triceps posterior, triceps brachii. Then the wrist flexors. So go ahead and show your arm. So we have it's pronator teres. It's right here. Goes across from medial to lateral. Pronator teres. Then the flexor carpi radialis. It's just below that. Then the palmaris longus. And then the flexor carpi ulnaris. Okay, that's the wrist flexors. Now, wrist extensors, you have extensor carpi radialis, all the way from over here, cuts across like that to the side, radial, so goes to the radius. The extensor digitorum longus, it's right here, and then the extensor carpi radialis. Or ulnaris, extensor carpi ulnaris here. Then we can do the brachialis, which is under the bicep. So kind of palpate it like that. This is the bicep, right? So brachialis. Brachioradialis, make a fist. Okay, it's this muscle right here. Brachioradialis, nice. Then we have the ulnar nerve, which is right in there. It's medial side in there. That's where your funny bone is. So if you hit it, it sends a tingling feeling to your two fingers and the hand. Then the medial collateral ligament, lateral collateral ligament, and the annular ligament is keep your hand like that. It's it connects the radial head that's proximal, so it's right here. Then we would do the range of motion test, passive range of motion, PROM, AROM, active range of motion. We're going to do active range of motion. So she's going to do flexion, elbow flexion. Now elbow extension. So do elbow flexion again. Elbow extension. Nice. Then the forearm supination. So you're already kind of doing it. So do pronation first. And then supination. Pronation. Supination. Well, now we're going to do the muscle strength test, the restrictive range of motion test with resistance. So I'll try and set this up real quick. biceps brachii, the brachialis, okay, and the brachioradialis, not the coracobrachialis. Now we're going to do wrist flex or extensor. Nice, that's triceps brachii and the anconeus. Okay, now forearm supination. Go ahead. Nice. Let's do that again. Nice. That's supinator and the biceps brachii again. Now forearm pronation. Do that again. That's the pronator teres and the pronator quadratus. Those are kind of in the name, supinator, pronator. Okay, now we're going to do same thing we did when we did the shoulder. We're going to do the neurological testing. So deltoid. Nice. That's C5, C6. Wrist extensor. Move this up. Wrist extensor. Nice. Then the C7 is the triceps and wrist flexor. Okay, nice. Now the finger flexor, C7 or C8, and then the finger abduction, adduction, like that, C1, nice. Now we're gonna sensory, go ahead, C5 right here, C6, C7, C8, T1, okay. And then we would do the reflexes. So it's kind of hard. So I would hold, her arm needs to be like this, supinating, and we'd go here and hit here with the reflex hammer. Then that's for C5, the biceps tendon. Then for C6, the brachioradialis tendon, we rotate and hit here, the reflex hammer. Then for the triceps tendon, same thing as last time, hit here. Nice. And now we're going to do the radial pulse. So I do this for 15 seconds. I get my heartbeat and I multiply it by 4. Say it's 19. That's 19 times 4, 76. So I'd say 76 strong and regular. If it wasn't strong, it could be weak. And if it wasn't regular, it'd be irregular. Then we would do the capillary test. Squeeze the finger. Should go from white to red within 2 seconds. For the blood flow. Nice. And we compare bilaterally. All right. Thank you.